We're now joined by Dr. Juan Rios, who is a professor of social work and the director of the Master of Social Work program at Seton Hall University, one of our higher education partners. First of all, thank you for joining us, Dr. Rios.
Thank you for having me, Steve. It's a pleasure.
The most significant social and emotional impacts, or the impact, if you will, on younger people 2 years plus into this pandemic, where have they suffered the most?
Honestly, Steve, it's a lot that's happening with young people not being able to have that social, emotional development that they normally would obtain from the interactions with each other and with their peers. And I really do believe that what our research is showing is over the past year, there's been a 30% increase in young people going to the emergency room as a result of anxiety, 25% increase amongst adolescents for depressive symptoms, 4% increase of suicide rates amongst boys, adolescent boys, and a 51% increase amongst suicidal ideation and a trip to the hospital amongst adolescent girls. So it's clearly evident that the result of the pandemic is definitely increasing a lot of the emotional challenges specifically amongst our youth.
Doctor, let me ask you this. Again, we have teenage children. We also have a young girl a young daughter who's 11. And I'm struck by, listen, nonverbal communication is 90+% of the entire communication equation, if you will. But that being said, I am struck by how challenging it is for her, for some of her friends, to actually just engage in conversation. Now, that's pre-pandemic. Social media, staring at the phone, constant, whatever. Has that been exacerbated? The inability to just have this kind of conversation, like that's so hard.
Absolutely. Well, adolescents aside, adolescents are dealing also with the developmental stages of individuating, developmental stages of building their own identity. Us as adults, it's been difficult for us to be in social spaces. We also have to really relearn what it's like to engage in a conversation that's larger than 180 characters. We have to be able to engage in conversations where it truly builds connection, because connection, what we find, is one of the factors to really combating depression and building resiliency. So if we don't have genuine connection, although we're communicating more through the use of our phones and technology, is that true connection and engagement? And that's what we really need to ask ourselves. And how do we build that into our interactions that are not happening through the use of physical interactions? And how can we really supplement that in spaces that alternatively we have not?
We're doing this interview remotely. We'd prefer to be in the studio. You teach, to disclose, I've taught and continue to teach at Seton Hall as a visiting fellow there. And I happen to be blessed to be able to do that in person this semester. It's a huge difference. Huge. When you have to be remote, you're remote. But explain to folks the dynamics, the difference, Professor, between being in a room with students versus doing this, the old school Brady Bunch thing.
Right. So it's the subtle nuances that occur in the classroom. It's being able to look at someone in their eyes with their real eyes. It's being able to lean forward and start to notice that nonverbal communication is showing that empathy, that concern, that being heard and listened to. Is being able to face and walk towards someone, which is that phenomenon of connection, of attachment. It's being able to just have that physical space wherein we are unified amongst both space, time, and our engagement, our full engagement, that I'm not looking at you through a screen, but I'm actually typing on the other end, that I'm here, fully here, and here, I'm with you. And our students begin to notice that. They see that difference because they can't run from that. They can't shut down their screen just when things get tough. And that's the resiliency piece that we have to be able to consider, is that when our youth and our adolescents in schools, when they're being challenged and pushed together to be able to answer some questions, to be able to work through and problem solve together, and through what we call distress tolerance, that helps build resiliency. That helps build character and confidence. That as sometimes we really feel safe through the screen and we feel safe with our mask in front of us.
You know, it's so interesting. I appreciate the way you've described it in such a scholarly fashion. When I teach, when I coach, when I do what I do in my other world as a trainer, as a coach, and as someone who teaches, I call it forced engagement. You know, I will call someone out and say, you know, Juan, let me ask you, what would you say the biggest takeaway is from chapter whatever? And some people have said to me, why do you call someone's name out, Steve? Why do you ask them a direct question? I said, because I want to force engagement. Well, you're making people uncomfortable. And my response is, look, I want to invite you into the party. I want you to participate. If you feel uncomfortable, that won't last forever. But if you just let people back away and 2 or 3 people manage the conversation, or they're the ones who are most confident, I'll get off my soapbox now, that's not healthy. Please, Professor.
Right, absolutely. So we all learn and develop our emotional intelligence through challenging our comfort zones and our comfort levels. And that's what you're doing, whether you're doing it in sports or whether you're doing it in social engagement. Of course, there are individuals that you know, are on the spectrum, and it's a little, more,
that's different.
More challenging.
That's different.
Right? That's very, very different. We're not talking about that. We're talking about in our classrooms and engaging students to be able to show up as their best selves in order to increase their own arc of emotional development.
Right.
Because our resiliency to be able to fight through some of those challenges is what's able to help us show up the next step. So, which is why it's super important to be able to build this type of forced engagement, as you mentioned, so that you and I can be able to develop those skills. So what we're doing is I can hear your argument and not shut down emotionally.
That's right.
Because you have a different perspective or a different point of view. And if we don't begin to tap into those nuances, we're going to move more into a polarized society, because then we're using cancel culture rather than counsel culture as a way to be able to engage and interact with one another. And that's a very important aspect that we're referring to here.
So well said, Dr. Juan Rios, who's a professor of social work and director of the Master of Social Work program at Seton Hall University. Doctor, thank you so much for joining us. You added so much to the conversation. Appreciate it.
Thank you so much, Steve. It's a pleasure being here.
That's Dr. Rios. I'm Steve Adubato. Thank you so much for watching. We'll see you next time.
State of Affairs with Steve Adubato is a production of the Caucus Educational Corporation. Funding has been provided by Fedway Associates, Inc., New Jersey Sharing Network, Johnson & Johnson, Atlantic Health System, the Healthcare Foundation of New Jersey, the Northward Center, Delta Dental of New Jersey, Valley Bank, and by the New Jersey Education Association. Promotional support provided by ROINJ and by New Jersey Globe.
I was diagnosed with cystic fibrosis when I was 2. It's hard to grow up with CF. But I have an awesome care team at Goriab Children's Hospital, helping me do the things I want to do, like play lacrosse. And now I've been recruited to play in college.
Where you go for pediatric care matters.
Atlantic Health System, because every moment is a moment that matters.